humility is something that was, as everybody has said, very apparent early on. And at first, there are several people in the cohort that are my colleagues at work, or that may even, have some authority in certain situations over me. And so it was a little bit, intimidating to share, as Denée put it, all that crap out there. But I think that it led to a lot of really meaningful conversations. And I think I've translated that into some of my interactions with patients. I think it's tempting to want to maintain that authority because you want them to know that, you know what you're doing, they can trust you. But then that translates to a distance that can be hard to overcome. And so, in the space of taking care of patients, it's intimidating to be vulnerable with them. But, just in the last few kind of experiences where I've tried that a little bit, it's been a really positive experience. And so I think kind of taking that vulnerability in this project and moving it outside of those walls into the kind of exam room or the patient care setting has been really transformative for me.
The very last day of the proximity project, I actually had to leave a little early because that was the next webinar for this other course. And so I kind of flipped from the proximity project into this other culture. And it was stark for me because, it was sort of more along the typical lines when I'm in a meeting with a bunch of healthcare professionals who are leaders in the field. Everybody's kind of holding their own space. We're all siloed. There's nothing in the chat box. So then all of a sudden, and I'm truly an introvert, I believe, I start putting all this stuff in the chat box. Folks are commenting about things that they're doing. And I'm like, oh, congrats, because we were doing a lot of that. Just a lot of, just being people. And so that did, open the space. Other people then started to chat. And even after I stopped, I could see that, there was more of that instead of the silence that I'm so comfortable with.
And I'll say with the medical education piece, that's kind of my bread and butter and a big part of what I really do hope to take away from this. It's really hard, but I really do hope to impart a lot of this idea of proximity to our medical trainees, the doctors in training. I think a lot of it is all the things that we've said already, but bringing the idea of proximity. And again, that was another one of the most impactful exercises. I think there was a list of, 20 or 25 questions that we went through as a group. And it was like basically asking, do you do life in the community, right? How much time do you spend actually partaking of businesses in the community or at church in the community? And realizing like we care greatly about our patients, but we don't actually spend time with them. We don't spend time in the community. And that's what being proximate is about.
Community interviews are just an opportunity. I think they've been alluded to. It just is to talk to some people that you wouldn't otherwise talk to, and just ask some questions about what they consider community to be. What are the strengths? What are the weaknesses? What do they want to see changed? And so, some of the questions, like I was a little bit worried about asking, and I've done 2 so far, and they've been awesome. We talked for 2 hours both times, and it was amazing. So I have to say, I think that's something I'm probably going to continue doing, even when I'm not officially in the proximity project anymore.
Such a big theme that I take away from this is seek first to understand. So I'm really looking forward to doing a lot of these community interviews and understanding the community more before we build the curriculum, so that we're not just building what we think is the right curriculum. It's the right curriculum for our patients and community.
Would not have been able to connect with her had I not reached out to Roshni, and I wouldn't have reached out to Roshni had I not been tasked to do so through the cohort. And it was turned into just a really amazing conversation with 2 basically complete strangers about what are the challenges that they have in their community around health, and how can Highmark or how can Denée be more helpful? How can we be more attentive and more impactful? That made my whole month, because now all I really want to do is like pause all my other work, which I can't do, and just dig into that community and be with them and figure out how we can help them. But it led to some really beautiful conversations and revelations and insights.
And I think in so many ways, there was, the community that we want to have with our patients and the healthcare, participants is the same community that we started forming amongst ourselves.